Styes and chalazions are swollen bumps on the eyelid that can be very painful, cosmetically frustrating, and can even affect your vision. So what are the 6 mistakes that patients are making that are causing them to get styes over and over and over again? Hi everyone, I'm Dr. Nagori. I'm a board certified ophthalmologist and you're watching the eyefacts.com channel. So let's start our countdown with number 6. Number 6 is touching your eyes excessively, especially with unclean hands. Obviously, unwashed hands can have bacteria as well as oil, and this can further aggravate the eyelid inflammation that is associated with styes and chalazions. Also, frequent rubbing of your eye and your eyelids just further aggravates that delicate skin in that area. So you really want to avoid touching your eyes and making sure that if you do need to touch your eyes, to try to wash your hands before doing so. This also applies if you have bangs, because if those are rubbing against your eyelid or sweeping against them, they can also cause you to have more eyelid inflammation due to bacteria that's introduced from your hair. Now, number 5 is one that I am guilty of, and that is sleeping with your makeup on. Chalazions are caused by blocked oil glands, and when you leave the makeup on at night, it can cause further clogging of your glands. Makeup particles and makeup debris can cause inflammation of the eyelid, which can again further aggravate chalazions as well as styes. The 4th mistake that I see patients making is that they don't recognize the signs of a stye early. If you're someone who has gotten styes in the past, then you know that feeling when it starts to come on. Your eyelid may feel a little bit full, it starts to get red. When this starts to happen, you really should stop using makeup immediately. And also, if you don't wear makeup, you should start doing warm compresses. Now, I do have a tip on warm compresses coming up, but when you do the warm compresses early on, it can help to thwart the stye from even happening. Number 3, the 3rd biggest mistake that I see is patients using warm compresses that are actually like very, very hot. So they're not warm, they're scalding hot. And this type of aggressive heat can actually aggravate the chalazion because heat increases blood flow to the area. This can sometimes worsen redness and swelling in an area that is already really inflamed. Extreme heat and temperatures can also activate inflammatory mediators in your body, which can then exacerbate the inflammation response. For example, if you've heard of a disease called eczema, exposure to heat in eczema can actually cause eczema flares and worsening of that inflammation. For the warm compresses that you're using on your eyelids, you want just enough heat to allow the trapped oil to loosen up and be able to leave the glands, but not so much heat that it's making it uncomfortable for you to put the warm compress on, and it's actually making the eyelid extremely, extremely inflamed. The number 2 mistake I see in patients who often get styes and chalazions is that they continue to use fake eyelashes or eyelashes that stay on their eyes for a very long period of time. It is totally fine to wear fake eyelashes for a special event, but it's really important that you take them off after the event is over, thoroughly wash the lids and lashes, and give your eyelids a break after you have worn them. You can also consider wearing magnetic eyelashes, but even then you're gonna wanna take them off when the event is over and make sure the eyelid is thoroughly clean before going to bed. Now, the number 1 mistake that I see my patients doing that is causing them to continually get styes over time is that after they've actually treated the stye or chalazion successfully, they don't keep up with the eyelid hygiene and the warm compresses. Now, you know that when you have a chalazion, you have to use those warm compresses pretty aggressively, not too hot, but frequency matters. So you want to use them a few times a day. But once it's resolved, you shouldn't just stop your eyelid hygiene regimen. You should continue to use the warm compresses at least once or even twice a day so that you don't continue to get styes and chalazions. Now, after you've done your warm compress on a daily basis, you should use warm soapy water to gently clean the eyelids and eyelashes. Keeping up with a good eyelid hygiene routine in between these flare-ups is really important to prevent further flare-ups. Hope you found this helpful. Remember to subscribe below, and I'll see you in the next video.